Welcome back to the Dr. A series with Invisalign. We're continuing with cases today, and we're going to talk about one of our patients who's had a lovely transformation, but it wasn't the most straightforward and it required a lot of careful planning. One of the things to mention at the moment is it is the best time to get your teeth straightened with everything going on out there. So please do bear that in mind. If you have been contemplating and thinking about it whilst we're wearing all these masks, it is a very good time to consider it. So this particular case was slightly challenging, and if you remember in the last post introducing Invisalign, we spoke about smile design analysis, and this is one of the reasons why it's really important, because anyone can straighten teeth, but to get the teeth analysed and put into the right positions to make the smile look absolutely perfect is the key fundamental planning process that needs to happen at the very beginning and will achieve, is the difference between achieving a fantastic smile and achieving an okay smile. So in this particular case, we analysed the smile right at the start with Molly. We looked at the things that we wanted to achieve and we wanted to change and tweak in this particular case. And the main factor that plays a big part in this is the lateral incisors at the very top, where we've got the gum lines that are slightly out of sync. Now, if we'd have straightened the teeth normally without taking that into consideration, and also how we're going to rotate certain teeth, it would have caused us a real issue later on down the line because they wouldn't have looked in exactly the right places. We needed to incorporate that right at the very beginning in the design to know that we want the centrals, the laterals and the canines to be in exactly the right places for the gums to look completely natural and make her smile look completely natural as well. So this is where the beauty of technology comes into play. We utilise the scanner, we scanned the details all on there as well as the photos and did our calculations digitally to be able to move the teeth and looked at the end result at the very start. We had to play around with it a bit to try and achieve exactly the right positions that we wanted, but once we got there, and we're looking at that at the screen at the moment, this was the final result that we settled on initially. And it's looking at moving the teeth from this starting position and slowly transitioning it into this starting end position. And that's the main thing we were trying to achieve with this case, is how to make the process as smooth as possible. When you look at the start photos at the very beginning, it doesn't look like you've got all the space that you need to move them there. But actually, the beauty of digitally planning it and analysing it allows you to see that actually the space is there to move the teeth into the right places without needing to think about things like removing teeth or more complicated things when it's analysed properly. Once we had the result that once we got the analysis that we wanted and we were happy with it, we then produced all the aligners and went through the normal Invisalign process from start to finish in this particular case. The beauty of this was that we had a dramatic improvement with the first set of aligners that we did. We got them as close to finishing as possible, but we still needed a couple of extra tweaks just to move them in that little bit more. And that's exactly what we did. We did another course of refinements with Invisalign. Again, no additional costs with this. It's always included in the price with any of the Invisalign cases that I do. And then we had managed to achieve the actual eventual goal that we wanted. And it's an absolute beauty. It's a really, really nice finish to this case. And in terms of confident smiling, there is literally no better end result that you can get than this one. So that's another summary of one of the cases that we've done, which was an interesting one to discuss. Hopefully it's answered some of the questions that you may have had about your own teeth. If you've got any questions or if you've got any particular concerns about your own individual case, send me a message, send me a couple of photos. I'm more than happy to have a look and give you a comment or an idea of what I can do to help. Thank you.